Good evening, everyone. Welcome to Point2Point podcast. I'm Robert, and with me, as always, is Tony.
Hello. Well, good evening.
And tonight, finally, we're going to start talking about TCM treatments. How do we start with acupuncture? How should the patient feel the first time they get acupuncture? What should they expect? Uh, how are they going to feel the next time? And, how long will it take before they can come back for the next treatment? So I guess we can do that.
Yeah, that's great.
Well, see, it's interesting because even in saying that, it varies because depending on the type of problem,
Mhm.
chronic problems, you're going to need a lot of treatments, but they're going to be spread out. With acute problems, tell you the truth, we'd like you to come in and do it 3 times a week because that's going to have a greater effect
Mhm.
doing it 3 times a week for 3 weeks. But with chronic pain, you have to start slowly because, you could have a leg problem, but that could have been related to a back problem, which could have been related to a shoulder problem. And once you treat the leg, then all of a sudden your back hurts. And then after your back hurts and you treat that, all of a sudden your shoulder hurts. So you're kind of working backwards with however the illness started. What happens if somebody comes to me with, let's say, they have knee pain and they want to start playing tennis again? This is actually follows a patient that I had back when I had a clinic a few years ago. I asked them, had they seen a doctor? Did they get an MRI? What did the doctor say? Since we do have Western medicine training, you know, we can also look at the x-rays, we can look at the MRIs, we can see if they have a meniscus problem, we can see if they have a tear, we can see if, there's problems with the muscles. Even with the palpation, we can localize the area where they have the pain. And in doing so, it helps us better custom tailor the treatment for what's wrong.
Definitely agree with you. We have to show the patients some Western medical terminology. Because if you don't explain it like in medical terms, just TCM terminology, a lot of people kind of confused. Like, what is chi? What is blood? What? But if you talk about some scientific medical terminology, they think, wow, you're a doctor. We were not doctors, but
Well, we're a health professional, is
we
what it.
help. Yes, we help care providers. So we should know these things because it's part of our training.
Yeah.
And when I explain to my patients, I sometimes tell them very detailed. And for example, people who have iron deficiency, so I have to explain to her that you mimic, especially women, they don't have iron deficiency without losing a lot of blood. So once you mention that right away, they think, oh wow, you know something. So they kind of be surprised that okay, you're good at it, you know what you're talking about. Even with certain type of pain, like the feet. I have a lot of 60 plus years old patients complaining of feet pain, and you must have flat feet. How do you know? Well, it's very common because back then they misdiagnosed a lot of patients. And you say you're walking, you have pain, and standing, and your arch is in pain. Yeah, most of the time when they look at their feet, they say, "Yeah, it's flat feet." Like, unfortunately for adults around that age, we cannot help them. Only to alleviate the pain, but we cannot change their structure anymore. I explained to them if they diagnosed it when they were little, they could help to form an arch on their feet. But once you're adult, your bone is calcified, hardening already. There's no way you can change the structure. So I just explained to them what methods you can use. If you cannot use acupuncture treatment, saying it's chronic, I have to be honest with them. It's kind of painful when we treat feet pains because there's not much meat around. So mostly bones. The bony landmarks equal more pain or more sensitive sensation. I'm sorry. We have to say sensations. If we say pain, they don't like that. But sometimes, be too honest, I forgot about it. Yeah, the word we chose is better if we said more sensations. Because when we say pain, sometimes if people who are not familiar with you, the first time they might think, oh my goodness, acupuncture is a torture. I'm not come again. The reason I mentioned about pain to my patient because I know the patients for 2 or 3 years already.
Mm.
But really, when we first start, when we talk to patients, it's best not to use the pain or that word because a lot of people doesn't like pain. That's why they come to see you. So if you say you're going to give them more pain, but why they want to come to see you again?
Pain is the number one reason why people won't see an acupuncturist because everyone equates needles to pain. And I can't tell you how many times I've had people come into the clinic and ask me just straight off the bat, does it hurt? Because that's the way, well, I'll use American society. That's the way that we understand it. We see a needle, getting stuck with a needle hurts. We don't want pain. So why should we go to an acupuncturist
Mhm.
who's going to stick a needle into her body, which is going to hurt?
Mhm.
And it's actually, I've taken the time actually to go and when the patient comes in and they ask me this, I will roll up my sleeve, take a needle, wipe my arm and say, this is the procedure we're going to do. And I'll do it. So if they tell me exactly where the issue is, if they had arm, if their knee, I'll try to do it there. But in general, I'll just use my arm because it's fleshy. You
Mhm.
know,
Mhm.
and most of the time where people have pain, it's going to be more muscular related. It's not going to very rarely have I seen some bone stuff, but just for a general example, take the needle, put it in, tap it. I said, there, it's done. They're like, did it hurt? No. I said, and that's one of the things that you had to realize. I'll do this on myself and literally show you that as soon as I put that needle in, I didn't jump. It's something that I'm used to. And if I wouldn't do this treatment on myself, I certainly wouldn't do it on you.
That is pretty funny and interesting. In the past, when I treat new patients, same thing. I show them the needles. Yeah, I do it to myself. Say, now you try. It doesn't hurt. Of course, we had to choose the best point, that net sensations. I have patient complain to
Yeah.
me about I don't want acupuncture treatments because the previous acupuncture provider hurts me, especially LI4.
Yes, that's the type of point you want to try to stay away from if it's ever going to be the first person's treatment. Large intestine 4, liver 3, these are all points that hurt like crazy. Some people even don't like intong because they'll look in the mirror or they'll think, oh my God, you're going to put it right in the middle of my skull.
Also, with yin time, we have to be super careful because some people are very sensitive. They could feel
Yes.
see or something happen because it's a very spiritual point. People are sensitive and you did not monitor the persons in the right way, and something happened, we liable for any damage to the patients or
Once again, a good acupuncturist who, and we've spoken about this before in another podcast, I think, a good acupuncturist knows how to also minimize any of those issues where you'll get bleeding underneath the skin. Generally speaking, I think that's really the only major damage that I have ever seen doing acupuncture. We've had some other scary stuff that we talk about.
bruise. That's
Yeah,
it.
just a bruise is like the worst I have ever seen. Yes, there can be some bleeding, but even still, the way they explain to me, and I find this a very interesting analogy, how acupuncture works is like putting a chopstick through a bowl of noodles. The noodles themselves part as the muscles because the muscles are fibrous. The needle itself is not sharp. it's blunt. The only reason why it breaks through the skin is because we tap it to give it enough force and pass the layer of the skin that has the nerve. This way, by doing that, all of a sudden you feel a pinch. And when I mean a pinch, it's like a push, and that's it. Then you bring the needle down. Now we're going to talk about something a little different, what some people consider Da Chi. It's the sensation that you get. This, I know it's funny. They call it an arrival chi or a Da Chi. They don't say ouch. They go, ooh, huh. Right at that point is where you stop, because you can ask them, do you feel something? They go, yeah, but it's not pain. Now, there are times, and you were talking about this earlier. If you get acupuncture and you feel a burning pain, immediately somebody's going to go, ouch. Yeah, that, bring the needle up a little bit because you've hit a nerve. That's what that burning sensation is. There'll be some people who will feel like it's a really, really tight pinch right at that time. When we put the needle in, we kind of turn it a little bit. If they feel that, turn the needle the other way. What happens is I just said, the idea of the fiber, what it did is it wrapped around the needle itself and it pinched it a little bit. So you unwrap it the other way, it loosens up. Oh, that's better. Those type of sensations are not Dutchy. and I know even in, I kind of laugh and snicker because Dutchy sounds like one of those magical things that we talk about. But it is a guide for us to know how well we put in the needle. Because after a couple minutes too, you'll see a red ring around it. And I'm not talking about a small area. I'm talking about a good size, quarter size ring around it.
So basically, what you said are correct. For me, since I don't practice Qigong or do a lot of martial arts, I really cannot feel the the chi, the chi on the needles. But I do see a lot of if some people who are very sensitive, you could just do one side of the points and that I've seen it, the other side start to appear, same spots, binarily without the needles. That's just a little bit interesting. I've seen. To me, for acupuncture treatment, some people ask me the sensations, how you feel.
Yeah.
All I can tell the people, I just being honest, it's kind of strange feeling because
Yeah.
all description is kind of strange. Some people feel the other way. Some people feel, oh, like the needle's moving by itself. I have needles. I know I'm not moving. I know the needle's like spinning, and I know
Okay.
it's just sitting there. I see some patient needles moving.
I'll
Uh,
talk about that one in a second too. That's another thing I've seen before, but it wasn't anything magical.
mhm. Then I also explain to patients that you feel some like antsy, like stuff moving up. That sensation is real good sensation. So I tell them that's in your chi rising, and yeah, the blood is moving to the right area. A lot of time after like a week later, my patient doesn't remember the feeling. They saw,
Ooh,
oh, like they follow how you
that's
feel.
interesting.
They just say, oh yeah, it's good, relieve the pain and stuff. But I want more like descriptions, like the treatments. I guess it's just like I said, when I told them it's like strange feeling, they just probably think, oh, it's a strange feeling. And it's hard to describe. It's very hard to describe about what is the real feeling for acupuncture treatment. But it varies from patient to patient.
Yeah.
Some people might think, wow, I feel great. Like, really? I only put common points on you and it's only one treatment. Really? Are you just making me happy? Because I don't think my skill is that great. It can be better, but I'm kind of lazy. That's being honest. I every time think I should train myself, but oh, maybe we could do like demonstration on the podcast. I do like cupping better than acupuncture treatments.
Well, that's another treatment method.
Yeah.
We'll talk about that. We'll talk about gua sha. We'll talk about tuina.
Mhm.
I want to throw this in before we change the subject, though, is this is for all my martial arts friends who watch this, because a lot of them, they like some of the mystical stuff. that we talk about, and they love some of the things that I talk at some of these little conventions that we have every year.
Yes.
You were talking about using qigong on the needle, which is interesting because I have seen that done before, but no one will ever talk about it. No
Oh,
one will
that's
ever,
a taboo. Secrets.
yeah,
Hidden secret. I we have couple of former professors of our school.
yeah.
Definitely, come on.
And they showed it, and it people were gathered around him going, "What's he doing?" He's like, "I'm not doing anything." But yet he was cupping the needles. We can see that he was chanting something, and the person's kind of twitching as he has a needle in his shoulder. I'm like, what the heck is going on? So you won't learn this. You won't learn this.
I, I remember that we used to have this professor. She's a medical qigong. Is she really a qigong master to a high level?
Yes.
Um, I remember my former supervisor. She told me when they had a meeting with her because they was going to introduce a medical qigong. So once she entered the room, the aura, they all sensed like once she entered the room. Oh, I'm not sure the men feel anything, but women is more sensitive and they're more intuitive. Men, not that intuitive. But since Gail is a course,
Well, as they say, men are clueless.
that's why I said I don't feel energy. I probably felt it and I know it, but I just like, oh,
Yeah, exactly. Oh, something happened. Why is everybody looking over there? The other thing I kind of laughed at, you were talking about the needle spinning. So it was funny because you reminded me of something that happened in our student clinic once.
ah,
Is we were, we were standing around the table. We were doing the acupuncture treatment. I believe it was on somebody's leg, and the needle itself would go like this every few seconds. And everybody's like, what the heck is going on? And the professor come over, looked, and goes, oh, you put the needle a little too close to the artery.
sorry.
You should move it up a little bit. And all of a sudden it was fine. Because it was moving in heart and rhythm
I
to
just was
heartbeat.
hard, yeah. It's like, come. Even sometimes when I need myself, like, okay, I know it's very close. You feel
Just
the pulse
what's
sensation.
going on here?
You say, oh, this is a match. For people who don't understand, it would be nice. Yeah, it's magical. Acupuncture needles, in according to Chinese medicine, they call it Shen needle. So basically, they have spirits. That's one of the news article in Chinese newspaper they published like that. Why they said that is because think about it, it's this needle. How the heck are you able to treat treatments? How people develop better? It's just needle. Our acupuncture needles can be magical. It depends on their philosophy. But for us, it's just needles to regulate the blood flows and your body energy. That's why I always explain to patients like, okay, we improve the circulations. The fact is, we will improve the circulations. In order to get less pain, we remove the blockage, adding more oxygenated blood, nutrients, minerals right there at the area that need the treatment, need the reinforcement.
Mm.
And how come some people can get the people who the hair to grow is the stimulation, but it's just like trees and plants. When we plant gardens, if we have no oxygen, the plants not going to grow. So we make some holes and the water's coming on, then it's oxygen moving in, then we start to grow. I just want to know other acupuncturist ideas of how they describes of the about the treatment. I have some people doesn't tell the patient at all, they just do it. That is also very bad for us. You would think you doesn't care much. You would think that you don't know anything. Then if they feel certain awkward pain, which is the sensations, they think, okay, you don't know what you're doing.
What you said is correct. I actually made a more simplistic way to explain it to people.
Mm.
Because even when you try to discuss the movement of blood within the body, they're like, well, how do the needles do that? That doesn't make any sense.
Mm.
the way I explained it to them is I said, think about the way your muscles are inside your body. I said, your muscles are like this. There's nothing getting through this. The only way you can and you'll turn white knuckled after a while because the blood can't move through it.
Mhm.
The needles have the ability to loosen the muscle, which allows the blood to go through. And you hit a muscle or you get a bruise, you can see the stagnation in the area with a bruise. You'll see it dark purple, turns to green yellow,
Mhm.
turns to a brighter color, and then eventually goes away. But the muscles are tight. The muscles are hard. If you ever did massage on someone or you ever felt someone who was angry or frustrated, they tighten their shoulders. You can
Mhm.
see they visually tighten up. And in doing so, even if you do that and you can feel how tight your muscles are. The reason why a lot of people today have this problem is because of ongoing stress.
Yep.
Ongoing stress just makes your muscles horrible, tight all the time. For whatever reason, using the acupuncture needle helps to relieve that tension. Talking about other treatments, yes, doing tuina helps, doing cupping helps. These are all certain modalities that we have that build upon making the muscles loosen up and allowing the blood to flow through the body again. After I explain that a little bit, they go, oh, well, that kind of makes sense. I know I'm going to hijack this again because of some of the martial arts people, but let's talk about Tai Chi and Qigong for a second. They talk about Tai Chi and doing it loose, and you have to be relaxed to do it. If you get somebody who's been working 60 hours a week every day, they're not going to be relaxed.
Mhm.
You know, they're all going to be tightened up. And even when you ask them to do certain movements, they're not doing it slowly. It's like hard. They're literally trying. And if you ask them, you have to relax a little bit, they'll say back to you, I am, because that's the way that they've relaxed. And it's very hard, again, it's like a chronic condition. It's hard to start reteaching the body how to literally just drop the weight, drop and be relaxed. Something you said earlier, acupuncture works for some people, but it doesn't work for others. This is a great example. If you have a half and half person who works 40 hours a week, has a moderate amount of stress, acupuncture is going to be great with because they'll be able to move into a more relaxed state better than someone who's been, again, 65 hours a week, going nonstop, drinking coffee, drinking high energy drinks. You put a needle in them, they'll go, ouch. You take it out, and I found that, oh, it didn't do anything for me. You have somebody who's very, very physical, somebody who knows how to relax, someone who knows how to moderate their stress. You use an acupuncture needle on them, they're like, I don't feel a thing. And again, that's just from some of the patients and some of the examples I've seen over the years.
For myself, for example, when I get acupuncture treatments, I really don't feel much of a difference.
Yeah, well, you're
And the
falling under this side of the scale too.
problem is, I know myself because one, I need more than one treatment once in a blue moon. If you want to see some improvement, you have to come at least 3 times a week, like you mentioned earlier,
Yeah,
for 3 weeks, or for me for a month. Back then, I've been standing a lot and hunch over, and now because of nowadays I do a lot of computer works and stuff. My neck, my shoulder, the upper part is like hard as rock too. That's why I prefer more cupping better. Because you do release more, you feel more sensations of relief and the muscle tightness better. Acupuncture, you have to tell patients it takes time. Unfortunately, most patient that we see, I would say 80% are chronic.
Oh,
Why?
yeah.
They're not going to see you when it's acute. They're going to see other doctors. So
Yep.
by the time they reach here, because they've gone through all therapists or different doctors already, and you're the last resort, please make it happen. But then this way, we have to educate them. You have to calm their mind or their zen first.
Mm.
If their mind is always jumping around, there's no way you can get this patient to relax. When we do acupressure treatments, I have patients when they reach to something very tender. I was yeah, I talk to patients and I've changed the tone of my voice. So I use it more like relaxation technique to having to be in and out slowly. The person goes off. Really, the techniques that we're using, we want to know. Is just think about if ourselves. If we want to sleep, right? We want to listen to some calm, nice music that's slowly dying down. Or in contrast to, hey, rock and roll, turn the thing up, blasting the music. There's no way you're gonna be relaxed. So I tried that technique and it's really good. So I do hoping near the future I can increase my skills and utilize what I learned the most. I've been not practicing that much. I do miss that.